did not, but I can make them available.
Good.
There you go. Thank you, Sten, for those kind words, and thank you for the invitation to be part of the panel today. I'm happy to share with you my experiences as a Fogarty International Clinical Research Fellow, and specifically the impact that the FICRS program has had on my own career development. As a cardiology fellow based in the U.S., the FICRS program came along at the right time in my fellowship experience, and as you'll see, afforded me a unique opportunity amongst cardiology fellows to pursue global health research. So just a bit of my starting point for background. I'm a fellow in cardiology at Duke University with a public health background and had previous experiences in international health during medical school and residency in various situations. But over the years have had repeated exposure to Kenya in volunteer experiences. And what struck me about my time in Kenya was the large burden and unexpectedly high burden of chronic non-communicable diseases in relatively rural parts of the country. And I spent most of my time, between 2003 and 2006, treating hypertension, diabetes, and heart failure in rural Kenyan clinics. And I came back to the U.S. and decided to learn more about that and read more about that. And as I exposed myself to more of those experiences, I desired to move from a situation of just having isolated experiences in international health, which was the term at the time, to more of a career in global chronic disease research. So as a result of the FICRS program, I got to spend last year at the Moi Teaching and Referral Hospital in Eldoret in Western Kenya, working alongside the AMPATH program. And in the next few minutes, I'll just share with you a few examples of how I benefited as a result of the FICRS program. So as a result of the FICRS program, I formed relationships with my international partners, and I put this slide first because this is by far the most important aspect of the program as it relates to starting a career in global health research. As most of us know, there's just no substitute for time on the ground with face-to-face interactions with new partners, and that human element of that interaction cannot be achieved with technology such as Skype or email, especially in the beginning. It also afforded me a chance to move past the initial culture shock experiences that you may have for the first 1 or 2 months working at a new site to a point where myself and my colleagues developed a mutual understanding. And these relationships are beneficial in and of themselves, but also served as a platform for future collaboration outside of the scope of my initial project. And I was able to get involved in larger projects happening at the program, including a home-based screening intervention, or a home-based screening initiative that they have for hypertension that will enroll about 600,000 patients over the next few years, and also involve the National Cardiac Society to hold its first ever meeting in our city based on our cardiovascular work in Eldoret. I also formed relationships with global chronic disease leaders locally here in the U.S., both at the Fogarty Center, including many members on the panel, and at the NHLBI. Last summer, as part of the Fogarty Orientation Program, I was invited by the National Heart, Lung, and Blood Institute to share my experiences and plans at their summer seminar series, which was a unique opportunity. And also got the chance to work closely with Dr. Tom Gaziano, who most of you know is one of a handful, if not the only US-based cardiologist who's dedicated their career to global chronic disease research. And Tom and I have developed a relationship over the years where he's now a co-mentor of mine on a KO1 application. I've also formed relationships and got to work with the future leaders of global chronic disease research, including my co-members of the panel and the other fellows in my year. There were 6 of us who were interested in chronic disease research during my year, and over the last year, I was able to work with both fellows and scholars on our individual projects. As an example, myself and a colleague, Mark Huffman, who's a cardiology fellow at Northwestern, we saw that there was a gap in the information available for cardiology fellows interested in global chronic disease research, and decided to put our thoughts together and share some perspectives, some unique challenges and opportunities that cardiology fellows may experience, which was published earlier this year. We were also interviewed because of our work together on the heart.org, which is a popular website for news and commentary for cardiology-specific topics, which was the first time that's been done. And also, Mark and I, because of our unique career paths, have been invited to speak at the American Heart Association meeting and the Canadian Cardiac Society meeting later on this year. As a result of the FICRS program, I've also believed that myself and my colleagues, we've gained credibility as people who are serious about this type of research. Having a year-long time of exposure, being on the ground, allowed us to engage in bidirectional exchange of information and experiences, and not just a situation where there's one person coming over to provide medical aid. Tuko pamoja is a Kiswahili phrase that means we are together, and it connotes a sense of solidarity. And being on the ground for a prolonged period of time and being able to weather the storms, both professional and some personal together, allowed us all to realize that we were all there for the same reason, for mutual benefit. In the back at my home institution, as I mentioned, training for global chronic disease research is a novel training pathway within cardiology. And with the help of the FICRS program, I was able to demonstrate that there is a commitment on behalf of the NIH for this type of work, and was able to build on the FICRS Foundation to create a 2-year clinical research training experience in global CVD research, which was a first for my university. And so the FICRS program was definitely the nidus for this experience, but I was also very involved with the Duke Global Health Residency Program, the Division of Cardiology, the DCRI, the Duke Scholars Award named by Dr. Greenfield, as well as the NHLBI Center of Excellence in Kenya, which I'll speak about here. As a result of the FICRS program, I was also able to engage in other NIH-sponsored global health programs. In 2009, the NHLBI and the United Health Group formed a collaborative network of centers of excellence in chronic cardiovascular and pulmonary diseases. And one of the requisites for applying to become a center of excellence was that you had to be an established FICRS site. And so our site in Kenya, in Western Kenya, in Eldoret, where the AMPATH program is housed, was awarded one of these grants. And as a result of being on the ground, I was able to take advantage of the programs happening within the FICRS program, but also the Center of Excellence, which involved research projects, but also training of our trainees in the Center of Excellence. As a result of the FICRS program, I was also able to improve my research strategy for that year. There's tremendous value in having call-free time at the beginning of a career in global chronic disease research, immersed in the local scholarly activities. And as a result of the program, I was able to hone my science and implementation. I started the FICRS program with an interest in atherosclerosis in sub-Saharan Africa, which remains my interest. But as a result of the program, was able to broaden my scope to include studies of HIV and cardiovascular disease, the prevalence of atherosclerosis, which remains an interest, and also get involved in some qualitative research looking at knowledge, attitudes, and perception. And underpinning all of this, being on the ground allowed me the opportunity to learn how to better implement these specific research projects, and also how to implement the changes or recommendations that will come out of these. And I feel that at the end of this, as a result of the program, I developed a strong foundation for work as a junior faculty member. And lastly, this is my last slide, there's the personal experience side of global health that is also invaluable. It's a picture of my wife and my 2 small children. As someone interested in starting a global health career for the long term, for the next 4 or 5 years and 10 or 15 years after that, it was important for us to bring our family to Eldoret as well. And so we got to know the area, got to figure out how my spouse would get involved in some of these other aspects here that I've mentioned. And lastly, as I'm sure we'd also agree, that there's the personal benefit of having a broad array of international experiences, or at least being exposed to other cultures. And Mark Twain put it his own way, but I think we'd all agree that it also makes you a better person. So with that, I'd like to thank you to the panel for the invitation, and thank you for your time and attention.